What is tuberculosis disease? Have you ever wondered what tuberculosis is and how it affects people? Tuberculosis, often called TB, is an infectious disease caused by a bacterium known as Mycobacterium tuberculosis. While it primarily targets the lungs, TB can also impact other areas of the body, including the kidneys, spine, brain, and skin. The disease spreads through the air when someone with active TB coughs, sneezes, talks, or sings, releasing tiny droplets that contain the bacteria. Others can then inhale these droplets. There are two main forms of TB infection. The first is latent TB infection. In this case, the bacteria live in the body but do not cause any symptoms or illness. People with latent TB are not contagious and may never develop active disease because their immune system keeps the bacteria dormant. The second form is active TB disease. This happens when the bacteria multiply and cause symptoms. Active TB is contagious and can be serious if not treated, but it is curable with the right antibiotics. Symptoms of active TB can include a prolonged cough, which may sometimes bring up blood, chest pain, weakness, fatigue, weight loss, fever, and night sweats. Early on, symptoms can be mild or even absent, making it easy for TB to spread without people realizing it. Certain factors can increase the risk of developing active TB from latent infection. These include having a weakened immune system, such as from HIV/AIDS, diabetes, malnutrition, tobacco use, and harmful alcohol use. Globally, tuberculosis remains a significant health concern. It is estimated that about a quarter of the world's population has latent TB infection. The good news is that TB is both preventable and curable. Diagnosing TB typically involves skin tests, blood tests, chest X-rays, and molecular tests. Treatment usually requires a course of multiple antibiotics taken over several months. In many countries, vaccination with Bacillus calmette-guerin, or BCG, is used to protect children from severe forms of TB. In summary, tuberculosis is a bacterial infection that can either remain dormant or lead to serious illness, primarily affecting the lungs but also other organs. It spreads through airborne droplets and requires medical diagnosis and treatment to cure and prevent further transmission. If you have concerns about TB, it is essential to consult a healthcare professional for personalized advice and guidance.